Welcome. I'm Mary Long, the founder of Her Story Network. Today on Unspeakable Things, we are going to talk about something that we rarely speak about, and that is sexual dysfunction in women, what causes it, what we can do to rectify it. And I'm very happy to say we have an expert on today to help us navigate these waters. We're joined by Dr. Lisa M. Valle. She is a board certified OBGYN and has been in practice for over 18 years. Her integrative practice solely focuses on caring for women with female sexual concerns in Santa Monica, California. Her emphasis has been on concerns such as pelvic and vulvovaginal pain disorders, loss, decreased libido, inability, difficulty achieving orgasm, arousal disorders, and various vulvovaginal disorders. She is a member of the International Society for the Study of Women's Sexual Health, the International Society for Sexual Medicine, and is a diplomat of the American Board of Integrative Holistic Medicine and a fellow of the American College of Obstetricians and Gynecologists. She has been featured on numerous TV shows, radio shows, and podcasts, and in print media. Welcome, Dr. Valle.
Well, thank you. Thank you for the introduction.
Thank you so much for joining us. This is a topic that is rarely spoken about, even behind closed doors. But through my own experience, as I had mentioned earlier, I realized this is something that women are afraid to talk about, but a lot of women are affected by. And I guess my first question would be, since this is your specialty and your background is OBGYN, did you specialize in this because you saw a need that wasn't being filled?
Yeah, so for several years, I actually just did routine OBGYN, delivering babies, things like that. And then I started to realize that there was a deficit in my training when it came to for pain with sex. So I started to kind of do some.
Excuse me, you just cut out 1 second there. Something pain with sex. Was
Yes.
it? Okay.
Yeah.
Just painful sex. Okay.
Yeah. And so I started to do some research and realized that I needed to fill this deficit by educating myself. And I attended CME conferences, and I found the International Society for the Study of Women's Sexual Health. And I ended up trying to get proficient at it. And after a while, I decided that I solely wanted to focus on that. Because as an OBGYN, I felt that we were in a good space to be able to appreciate the need to fill that void in our specialty.
Now, do you find, is there sexual dysfunction across the board, or do you find that it's more prevalent in women as they get older?
It's actually through all ages. My youngest patient is probably around 16. My oldest is probably about 89. But each has a different cause. So.
And is there, because being a woman who has gone through menopause, and this is something that it's difficult to talk about. You see, even now I'm kind of stuttering a little, but I said I was going to be committed to talking about things that women don't talk about, but need to talk about on the show. And that is my own experience after going through menopause. I was not in a relationship for a long time, like at least 15 years, maybe. I hadn't had intercourse. And when I would go for my exams to the gynecologist, that was so painful that I thought that chapter of my life is over. I can't even tolerate being examined by a doctor. There's no way I'll ever be able to have sex again. And I know a lot of women say, I don't care. I'm still good friends with a lot of women my age. We've been friends since we were kids. So we share a lot of these things we go through in life. And they say they don't care. And I wonder if they don't care just because they've kind of given up and don't know that there's any way to rectify it. Because I noticed the first time I had lunch with them and I was sharing my experience of what I went through, I saw them asking questions and even some of them writing notes in their phone of what helped. So anyway, a little over a year ago, I did become involved in a relationship and I wanted to have sex again. I did care. I cared very much because even though we can take care of ourselves or maybe shut that part of ourselves off, because I think society kind of throws us away when we get older. So maybe we throw our own sexuality away because we buy into that we're not sexy anymore. But anyway, I did care, and I had a wonderful gynecologist that helped me find. We tried a few different things, and then the one thing that really made a big difference to me was vaginal hormones, which I had a terrible time with taking hormones during menstruation. But it's my understanding, correct me if I'm wrong, that when you use vaginal hormones, it doesn't go through your whole body. Is that correct?
Yes, just there's a small amount of absorption when you first insert them, but for the most part, it's just localized. So we often use that to treat pain with sex, recurrent UTIs, because what people don't know is that when you get recurrent UTIs in menopause, it's frequently from the thin tissues of menopause. So
Is that
not
right?
pain with sex, yeah.
Wow, that's fascinating. Nobody had ever told me that before. So if you get recurring UTIs, it could be helpful to use vaginal hormones
Mm-hmm.
because it's the thinning of the vaginal walls. It's
It's
very,
actually the thinning of the opening of the urethra, which is right at the entrance of the vagina. But what happens in menopause is all of the tissues of the vagina and the vulva change as we age. And so sometimes in some people, I kind of always say that menopause manifests itself differently in each person. So for one person, it might be pain with sex. For somebody else, it might be recurrent UTIs. For somebody else, it might be decreased sex drive. For somebody else, it might be hot flashes. My theory, in my own personal theory, there's probably some genetic difference amongst all of us as to why we manifest through menopause in different ways, but everyone is different. But I think this is a good conversation to have because we don't really talk about it.
we don't. And the truth is, from my own experience, I was so relieved to find out that there was an answer and that part of myself wasn't shut down. And I do feel differently. Honestly, there's more vitality. It's aside from the physical connection of
Mm-hmm.
physical intimacy and having sexual relations with someone that is so important, but it's empowering. I think I want to say I feel more empowered, like all of me is functioning. I think before I felt a part of me was maybe defective, and maybe, like I said, buying into society's view of I'm an old lady now, so you're not sexy to anybody, so give up on that part of your life. I think maybe as much as I try to fight against that kind of programming, I think
Mm-hmm.
I was still kind of absorbing that and being able to find a solution to this and have an active sex life again. And I can tell you, it is not painful at all. It is very enjoyable. I'm very happy with it. Um, it really makes a huge difference. And that's why I'm so grateful for what you do and that you would come on and talk about this, because so many women suffer in silence. We hear so much about men's sexual dysfunction because
Mm-hmm.
they're allowed to have any kind of sex. So we can talk openly about if they can or can't have it, even though they're really embarrassing about, they can't get it up or whatever, but they make jokes about it, or, we're inundated with ads for how to fix it.
True, true, true. Have you ever wondered that during dinner time they'll have an ad for, and I won't mention the names of the drugs for men, but you don't ever talk about
Right.
anything related vaginal. Do you see vaginal estrogen being advertised
No,
at dinner
no,
time?
no.
No.
And that's why I'm so grateful to have conversations like this. So maybe can you just, I know everybody's different, but is there anything that you see? And I think also, how much do you think our emotional trauma is attached to our physical issues with sexual function, or is it?
So I always take it from a biopsychosocial perspective. So I always feel that there's always going to be a psychological piece, your upbringing, um, what your ideas about sex are, all of your experiences, all of your traumas, all of those things. So when I first see a patient, I always ask a lot of those questions. My first intake is usually just talking for about an hour because each piece needs to be addressed. And there's so many women that have had a history of trauma, either through childhood, adolescence, college. Um, one of the questions I ask is, have all of your sexual experiences throughout your life, have they all been positive and wanted? And I can tell you that as I've asked, hundreds and hundreds of patients this question, most women, in one way, shape, or form, they'll either say, well, it was consensual, but it wasn't positive. Some of them, unfortunately, definitely not consensual. And then my next question is, have you talked to a therapist about it? And some of them have, some of them haven't. But I find that so sad that there's so many. I think that the numbers of that are probably, when they probably look at the literature, and I don't know what the percentage is, it's probably much higher than what they say it is.
It's interesting you mentioned about, I love the way you put that. Have your sexual experiences all been positive and consensual? That's actually a really respectful way to ask that question. Several years ago, maybe like 6 or 7 years ago, I got a lot of UTIs, and nobody ever told me that the thinning of the walls could be causing that. But I went to the doctor and got the usual whatever it is that they give you for UTIs, and it wasn't working. And so I went back to the doctor, and it was my GP, and he said, I think you need to see a specialist. I forget the name of it. But anyway, I went to the specialist. So I had to do like a laparoscope procedure. And he did the laparoscope. And in the room afterward, as I was waking up, he said, have you been sexually assaulted? Which I immediately felt really ashamed, which is the strangest thing with sexual assault. Why we take on shame, I don't know. And it's not something I never talked about or haven't worked on healing or anything, but it was just that strange is that this stranger was asked. And I said, yes, why? And he said, whatever this condition is, we see this in women who have been sexually assaulted. And I was sexually assaulted in my teenage years. And here I was 50, and this doctor, by going inside my body, could tell that I had been a survivor of sexual assault, which I found astounding, that our bodies would develop something around that kind of trauma. And I wonder if so many of these things, because I think a lot of times we're made to feel like it's in our head,
Yes.
like we're imagining it.
Yes, unfortunately. And so there's a certain group of physicians that are very open and knowledgeable about this. And then there's another group where, and even in my training, I remember like being taught, oh, just, tell them to drink some wine, tell them to go on vacation. They must be depressed, things like that. So misogynistic. Yeah. I always tell, and then sometimes even women will ask me, well, are you sure this isn't all in my head? Even after I've diagnosed them with, for example, a sexual pain condition. And my response is no, definitely not. And we go over everything. And then my next response is, do you think that if a man had penile pain, do you think that they would be asking that question, or pain in their scrotum? Do you think that they would be asking that question? And they always laugh and they say no. I'm like, okay.
Wow,
Right?
that's really powerful
Because,
right there.
right? Because I can't ever see that happening. Right? It's just kind of, we've been taught. And, I think it also deals with how women have been taught in medicine and society, right? That we're hysterical, right? It's all in our head, that kind of thing. So I think there's like a lot of history behind it. So it'll take a really, really long time to kind of get rid of that connotation that any kind of pain with sex or any of that is not just psychological. Is there a psychological piece to it? Yes. Does anxiety and depression worsen the interpretation of the pain? It can. But are you imagining it? For the most part, no. So,
Don't you? I feel that there's kind of a covert message that women aren't really supposed to enjoy sex anyway. And if you do, you're a whore. I mean, there are cultures that perform genital mutilation so women cannot enjoy sex. And that is extreme, yes, and that's not happening here in the United States or most other countries, but it's still happening. And I really do feel on a very subconscious level, it affects us all. As girls, we are either sacred, holy, virginal mothers, or we're whores who like sex. And those are pretty much the two, still even as much as they say we've evolved, I do really think that is the underlying message. If you're young and hot and exploring your body and sexuality too much, you're a whore. And once you get to a certain age, especially after you become a mother, that should be something I honestly, Dr. VA, when I was a teenager, I can still remember having a conversation. I was with my one of my best friends at the time. We were sitting at the table with her mother, and she was telling us women are not supposed to enjoy sex. She had 3 kids. She said, when I would do it, I would say, this is for my babies. This is for my babies. Like she was enduring torture as a sacrifice to have children. And I really do think that's not so far out there. It may be a little extreme, but I still do think the general message is we're not really supposed to enjoy sex. And certainly what's happening in our government with our reproductive rights, we are baby machines. That's what we're supposed to be. We're not supposed to be enjoying this body of ours.
I think that there's two competing forces with that, because you do have those people that believe that they should have control over our entire reproductive rights, right? But you also have what I see are younger women who, in this new generation, they don't see it that way, which I'm hopeful, right? The like some, so for example, I'll give an example. Usually I hire pre-medical students for medical assistants, and I try to mentor them to try to get into either a master's program, whatever they want, or medical school, some kind of pre-health professional. And sometimes I will kind of instill on them as a woman how difficult it is to be a professional, to go through medical school, what I went through. And I'll even use the example, like my own mother, like not being able to have a credit card,
Right.
her name, when she got married. So, and they look at me like, what? And I'm like, go look at the history. This isn't all that long ago. So I feel that they're very open, and we kind of have like a clash of cultures where you have like this younger generation that seems to be very open, and then you have older generations that some of them are upset with the fact that things are the way that they are and they don't know how to change it. And then you have this other set that wants to control, reproductive rights, for example. And so it's kind of like a big melting pot of mixtures of things, and feels like kind of like chaos right now, right?
Yeah. That's very hopeful about the young women, but I'd be really curious to hear what the young men actually think,
Yeah,
what
that
they
I do.
really think.
Yeah.
Because I come from a really large family. I'm number 6 of 7, and my mom was having kids for like 20 years. So, my 2 older siblings could biologically be my parents. That's kind of how it is in these big Irish Catholic families. And oh, I lost my train of thought. Sorry about that.
Okay.
What we were talking about, we were just talking about that maybe, okay. So here's what it is. So the middle 2 kids were 60s kids, hippies, long hair, all that kind of stuff, all the sexual revolution, civil rights, women's rights, all that kind of stuff. And especially, my one brother and all his friends had the long hair and the beads and all that. But what I find interesting is as adults, these men that were all for all this liberation are their father's sons. They think and they have fallen right into line with exactly the way their fathers thought. The only difference is they're not wearing suits and wingtips and fedoras. They're
No.
wearing different clothes, but those deep-seated beliefs about gender roles still are there. And I hope I don't really know, but it'd be interesting. It'd be a hard conversation to have because I would wonder, would they say what we think, what they think we want to hear, or have these roles evolved, which I hope is true.
Yeah.
But that's it's a very interesting question. So I think what I would like to ask now, if you don't mind, is there anything that you see? I know everybody's different, but, and I don't want to just stay on older women because I'm an older woman, but as you say, younger women have these issues too. Is there anything that you're seeing more of in younger women? And what are some of the remedies for these issues?
So I find that younger women are more apt to come sooner when they have sexual pain. Instead of waiting years, which my older patients might wait until it gets to a point where it gets really bad, they kind of ignore it. But my younger patients are coming sooner. Now, I'm not going to say all of them, but a lot of them. And I have hope for that because they recognize that it's not normal, right? And so it depends on exactly, it could range anywhere from, for example, somebody could have endometriosis. Another patient can have something called vestibulodynia, where they have pain at the entrance. That's the most common thing that I see in the office. Sometimes somebody could have like a chronic vaginal candidiasis, like a yeast infection that they couldn't get rid of, and it's causing lots of inflammation and pain. Sometimes they have pelvic floor dysfunction, where their pelvic floor muscles have pain, and they have tight muscles, and every time they have sex, they experience a lot of pain upon penetration or throughout. So it just kind of depends. There's a whole list of things I could list, but those are the more common things that I see.
And some of the remedies, are they all pharmaceutical? Are there exercises? Are there procedures?
So many of the people with pain normally have a pelvic floor dysfunction. So, and all that entails is doing a pelvic floor exam to figure that out. And then I refer them to a pelvic floor physical therapist because, I usually explain to them, you have XYZ causing this pain, but your pelvic floor is also causing pain. So we need to get rid of that pain generator while I take care of the other aspect. For example, like with vestibulodynia, there are many causes. So that's like pain right at the entrance of the vagina. So in an older woman, menopausal, that's what we call genitourinary syndrome of menopause, where the tissues get thin. And in a younger patient, they can be caused by all sorts of different things: nerve issues, hormonal issues, infections, things like that. So it's kind of varied. Sometimes it involves topical hormones, just like it does for older women. Sometimes it involves treating whatever infection we find. If it's endometriosis that I suspect, I usually will send them to an endometriosis surgeon that they'll be able to kind of, if it's after their pelvic floor has been treated, after they've done like some dietary changes, because most of the time I always address the nutritional component, especially younger kids. Like, what are you eating? Like, oh, I'm having like French fries and sugar all day.
Can you expand on that? Because I've heard that
Yeah.
nutrition can affect our sexual health.
I feel so. Basically, what I do is one of the first questions I ask is, okay, so go throughout your day and tell me like what you eat. So if somebody tells me they end up eating sugar all day, which is very inflammatory. They don't have any fruits or vegetables or anything like that. I usually will encourage them to like either make small changes, for example, decrease their sugar intake, um, or I will tell them to go meet with a nutritionist if it's gotten to the point where I feel like it's affecting their health. Because they usually tell me other things. For example, oh, I'm tired all the time, or I don't feel good, or I don't have energy. So, like, I feel like that aspect, and I don't just believe in just treating just their vulva and the vagina, right? Like, that vulva and vagina belongs to a whole body. So, usually from my perspective, if someone's complaining of these other complaints, I have to take care of those too, so that any kind of sexual pain issue or anything else going on. So if there's any issue where I think nutritionally, because I feel like that's been discounted, sometimes they, okay, well, go eat healthy. Well, most of the time they don't know how to eat healthy, right? So you have to teach them. So I usually will try to encourage them to do the Mediterranean diet, which is probably the most studied diet in the scientific literature when they look at like sexual health and things like that. But and that just basically involves, I tell them like lots of different colors on your plate, right? 2 servings of fish if you're a week, if you're of reproductive age because of the mercury. Try to nuts, healthy fats, avocado oils, minimal sugar, that kind of thing. Because by the time that I do all of that, it ends up that they come back and they end up telling me, oh my God, I feel so much better overall, meaning now they have the energy to tackle whatever we're taking care of, right? Because a lot of times they might come in and they're like, oh, I don't have energy to like, apply my medication or go to pelvic floor physical therapy, or sometimes I will send them to a sex therapist too. And it involves what I call like a lot of spoons, like a lot of energy throughout the week to be able to tackle all of that. And if they're not feeling well overall, it's not going to be very successful.
So I want to make sure I'm clear. Are you saying that the food does affect the physical function of your vaginal tissues, or it's just
Just
helpful in your
overall
overall
wellness.
health?
Yeah.
Yeah,
Yeah. Just,
overall wellness.
yeah. Because I feel like when you're taking care of any kind of sexual problem, you're not just taking care of just that part of the body. Like it should be the entire body, like as a holistic approach,
Right. The
because
whole mind, body,
otherwise
spirit.
it doesn't, you could take care of pain, but then if they don't feel well or they can't get out of bed in the morning, right? They ache, that kind of thing. A lot of that is what are they putting into their body? And then once you actually make sure that they're taking care of themselves and eating enough protein, like are they exercising? Are they going for a walk? Okay, so now then I ask, okay, so how are you managing stress? Like how do you manage stress? And if they tell me, well, I watch TV, and I'm like, okay, let's go through what we should do to help manage stress, because stress affects pain. It's kind of like, and I tell them it's like a volume, kind of turning up the volume of pain. It's not that it creates the pain, but it's going to make it worse. So we'll go through like, okay, so why don't you take a meditation class? Like do you do deep breathing, like, things like that. What other things do you enjoy? Do you have any hobbies? Do you do something with your hands? Do you do something artistic? And I can't tell you how many people I've asked, and they're like, oh yeah, I used to do that a long time ago. And I don't know if that's just a pandemic thing, because I feel like the pandemic has changed the way people go about their daily lives. And I feel recently, like I'll ask them, I'm like, okay, so like how do you manage stress? And like, well, oh, well, I used to draw, or I used to sing, or I used to do these things. I'm like, okay, so why don't you do those things now, to help you manage the stress, right? So like that's just another aspect to it that I make sure that I take care of too.
And I think it's important to point out, and correct me if I'm wrong, what you're saying is not you're having these problems because you're too stressed and you're eating wrong or whatever.
No,
There are physical reasons you are having these issues,
exactly.
and you can help with that. But what you're trying to do is the holistic approach, which is mind, body, spirit, everything connected and functioning together.
Exactly.
Okay, I
Exactly.
wanted
Because
to make that clear.
if they're able to manage the stress a little bit better, then if they have, like, for example, like a flare with their pain or a little setback, they're able to like mentally cope with it a lot better. Because sometimes if they get too overwhelmed, they'll just say, screw this, I'm done, I'm not doing any of this, right? It's kind of like watering a plant. You can't just water one little root, you have to water all of it, right?
Right. One other thing I want to ask, you touched on this. You said, you know, if you can't help them, you send them to a sex therapist.
Mm-hmm.
So what's the line when you say, you know what, this is something for a sex therapist? What do they do that you don't do, and what would be the point where you feel someone needs that help?
So a lot of the cases do involve needing to send to a sex therapist, and a sex therapist is someone that has been trained specifically in sex therapy. So, for example, you know, somebody that has sexual pain and has anxiety with sex, or somebody that was brought up in a purity culture and has a lot of shame around sex, and they happen to have pain with sex, right? Those are just two examples. So that's why at that very first visit, I try to kind of tease out what kind of factors might be affecting them. And then when I feel like maybe they're mentally ready, because I can't throw everything at them the first time I see them. And then I'll say, okay, now that we've treated the pain, how are you feeling? And then if they tell me, okay, I'm still having anxiety about sex, or then I'm like, okay, let's talk about what a sex therapist does. And then I'll give them resources to see. But usually, for the most part, sometimes it's not a sex therapist. Like, for example, if someone has uh, like just depression, not related to sex, but just to everything, then I'll make sure that I send them to just a straightforward therapist, because
Right.
that affects it too. If they have trauma, for example, I usually send them to a trauma-informed sex therapist, which is a little bit different.
Right. And that's very important because there are so many of us who are survivors. Um, Out here in this world, they say 1 in 3 women will be sexually assaulted by the time they're in college.
Mm-hmm.
Um, 3 to 5, I think. But I think, honestly, I think those numbers are low. I think we all experience some kind of sexual trauma. Certainly, you know, this happened to me when I was a teenager, but I could fill pages with all the inappropriate and other outright abuse and assaults that I have encountered throughout my life that I think we all do. And it becomes so commonplace. I'll have so many conversations with women because I speak openly about this, and they'll go, "Oh, nothing ever happened to me." And then as we're talking, then they'll say, "Well, this happened, but it was no big deal." It was no big deal, because that's how we learn to deal with it.
Yeah.
We're so surrounded by it all the time, the inappropriate comments,
Very.
words, gestures,
Yep.
grabs, whatever it is,
Yep.
that that we dismiss it ourselves. And I do believe, and you're a doctor, so I'm sure you could speak to this more than I can, that we hold that in our body.
Oh, for sure.
And I think then when we encounter sex again,
Mm-hmm.
we're still freezing up like that because of that trauma we're holding that we've never really processed.
Very, very true. Very, very
Okay.
true.
One other thing I do want to just touch on before I know you have to go. And this is, you know, as women get older and kind of abandon our sexuality, um, you know, I was thinking I see things like in movies and stuff that affect us that we don't even realize we're taking in. Certainly youth and beauty are
Mm-hmm.
the gold standard. That's the commodity. When you get to be middle age, 40s, 50s, 60s, you're pretty much invisible and your sexuality is gone. And I
Mm-hmm.
noticed this. I was rewatching Something's Got to Give, that movie with Diane Keaton and Jack Nicholson the other night. And so most everyone's seen it, but if you haven't, sorry if I'm spoiling it, but it's a pretty old movie. So hopefully everyone's seen it. But anyway, so he's like 60 something, and he's one of those playboys that always date younger girls. He's a very successful record producer or something. He's dating this young girl who brings him out to her family's house in the Hamptons or something. It's Diane Keaton is her mother. something happens. He ends up having to stay there with Diane Keaton. The young girl takes off. She wants to go back in the city. So it's Diane Keaton and Jack Nicholson there. And, it's a meet cute, of course. But the first time he encounters her naked body, so he's wandering around and he has to stay there because he has a heart attack. He's wandering around the Hamptons home. She's in her wing of the house and she's walking in her bedroom naked. And he turns the corner and sees her. And she's like, of course, she's shocked, covers herself up. He covers his eyes and like, oh my God, like he's just seen the most disgusting thing. He slams into pictures. They all fall off the wall. And then he's talking to his doctor the next day and he's like, can you be attracted to something that you used to find so reprehensible? He uses words like that, like basically like he saw a, a pile of garbage or a bleeding animal or something. And so I just wanted to do this. I happened to look up. I thought, when was this movie made? Then I looked up Diane Keaton's age and Jack Nicholson's age. Diane Keaton was 55 when that movie was made, and she was in phenomenal shape.
Yes.
Jack Nicholson was 66 and probably 40 pounds overweight and balding. But him seeing her body was so repulsive, he had to cover his eyes and slam into pictures. And I really do believe this is part of what we're doing as women who get older, because society throws away our sexuality and says it's not useful anymore or it's repulsive. We do that to ourselves.
Very true. So was that screenplay written by a woman or a man? Do you know?
I'm gonna guess a man. Okay. Most of them are. Most screenwriters are men these days. But I will look it up afterward to check. But even sometimes women, we've so internalized the patriarchy, and sometimes just to get our work seen or made, we have to kind of play that part.
True. I mean, I'm in Los Angeles, so I'm where that stuff evolves from. And I have a lot of patients in that industry. And I've always told them, I'm like, we need more women. We need more stories. We need actual, all different ages. We need to show that all ages are having sex, that it's not disgusting, that right? Like it
or
needs
funny.
To be commonplace, right?
Yeah. The movies now that they make, honestly, I love all these actors. There's like 4 main of the actresses that are in their 70s and 80s now that seem to be making these movies. I usually don't go see them because I know exactly what they're going to be. And there's always going to be the one old lady who's the sex fiend. And isn't that so funny that this old lady still wants to have sex? So ridiculous. And I just find that such a turnoff. It's like older women and their sexuality, if they're displayed in movies at all, it's as comic relief, because what a joke that women that age would want to still have a healthy sex life.
True. I agree. I think it's a big problem. I mean, I've always said this too, even just representation, different ethnicities in movies, women in movies, showing them sexual in different types of situations. I think it's a big problem because I think that's kind of what we're talking about. Like, I think it reflects onto society and how people think. And then, therefore, that affects me in the office, having to dispel any myths or any misinformation that they get from out there, unfortunately. But, I mean, you have people like Reese Witherspoon, right? Like, that's trying to promote women making movies, right? All of those things. I really respect that. But you need more women doing something like that.
Yeah, well, I agree 100%. Any closing words? What advice would you give to women who are struggling with this kind of thing? Should they just call any OBGYN? Is there something specific they should look for when they're trying to find some kind of help for themselves?
So they should ideally find someone, for example, through my society. It's the International Society for the Study of Women's Sexual Health. It's ishwish.org. Basically, they could find a provider on our website, and in their locality, they can find a practitioner that has had some training in how to treat what we've been talking about.
And if they'd like to get a hold of you, how can they get a hold of you?
I am located in Santa Monica, California, and my name of my practice is Oasis Women's Sexual Function Center.
Okay, well, Dr. Valle, thank you so much for being with us. This has been so helpful. And I think that's about it. I think we've covered as much as we can, and we'd love to have you back on at a later date to talk more about this really important issue that women just don't talk enough about.
Sure. Thank you for having me.
Thank you. Bye-bye.
Bye-bye.